Hello, everybody. It's Dr. Troy here on the Absolute Life Radio Show. I'm so excited you've tuned into us today here on 93.9 KPDQ FM. I've got a great show in store for you today. I've brought a ton of information into the studio, and I want to share it with you, our special listeners. I recently wrote a newsletter in my office entitled, "What is Going On Around Here?" And in that, I start off by showing how our office works, what our mission is for our community, the people that live in our community, and people across our country, and even out into the rest of the world. And in the last few months, things have been coming clearer and clearer to me as we continue in this fast-paced, busy world. We as average Americans, listen to this, are getting sicker and sicker and sicker. And I always ask patients, how are we doing with our health as Americans? How do you think we're doing? And everyone the other night that I did a talk with, they said, we're getting sicker. We're sicker now than ever. And they said, you know, we've got to do some things to change this. In the past few months, I've seen some of the sickest patients darken my doorstep that I've ever seen in the last 19 years of practice. People and families in our community in Vancouver and in the Portland, Oregon, and Washington area, they're hurting more and more than ever, and they really have no idea what to do. This is why I get on the radio. This lady asked me the other day, she said, why do you always share the negatives about medicines and vaccine and all these stats about death and dying? Don't you just fix bad backs? Isn't that what chiropractors do? Isn't that really what you do? You're just a bad back doctor. And I looked at her and I said, are you kidding me? I said, don't you understand that the treatment of sickness and disease with medication and surgical procedures is the #1 cause of death in America? Do you understand that? Dr. Fundenberg says that'd be like crashing a jumbo jet every other day full of people. That's how many people are dying due to conventional treatments and surgeries. So I just said, you know, I said, I'm like this. Don't you understand that this kills more Americans than heart disease and cancer? I said, I'm not just a bad back doctor. I'm here to share the information that literally can save and transform people's lives. And you know, somebody's dying every 30 seconds because of properly prescribed medications, because of the interactions. That's what the stats say in the Journal of the American Medical Association. It's every 30 seconds someone's dying from the treatment or that condition of a disease process that's going on in their body. And you know what? That's not okay with me. That's not okay with other doctors across the country. Everywhere you look and every patient I meet, guess what? They don't want to be on medications if they can help it. They don't want to have unnecessary surgeries if they can avoid it. But the question is, what are you going to do to avoid it? What are you going to do? And the answer for most people is not a darn thing. And that's the saddest part. Is it's not necessarily their fault, but it ultimately is going to lead to that. Guess what the medical model says you should do with your health? Well, everybody understands this. They say you should only go to a doctor when what? When should you only go to the doctor? When you're expressing symptoms, when you have back pain or when you have neck pain or maybe you have a bleeding ulcer or other conditions, a headache, chronic arthritis pain. When do we go to the medical provider and what do? They diagnose us. They put a label on whatever the condition is, right? They label it. And this is not what we do. You know, we're not looking for diseases and cancer or anything like that, even though we've been trained to evaluate people for that. Most people will do this. They'll say, hey, I'll do nothing until what? Until it hurts really bad or I can't breathe or I have to call 911. When they're wheeling me into the ER room on the gurney, this is when reality hits a lot of people. And they'll say things like this. I wish I would have taken better care of myself. So in the medical model, it says if you have a symptom condition, what do? You do medication. You throw medication at it or some sort of chemical, and if the chemical doesn't work, sometimes it might, sometimes it doesn't. In many cases, it doesn't. You throw this chemical at it. What happens if it doesn't work? You go back to the doctor, you call the doctor, and they up your dosage. Or they change the medication. And if that doesn't work, then what's next? You get on this merry-go-round, and I've had people who go from doctor to doctor to doctor, and they keep doing the same thing over and over and over again. More medication, change the dosage, or you'll get something like this. Let's go off label. I don't know if you know what off label is, but that's where they really don't know if the drug will work for this particular condition. There's never been studies done. So, for example, you go in for high blood pressure, and they've tried all the research blood pressure lowering drugs, and none of them are working for you. But then they say, hey, why don't we try this antidepressant? We've known just a few people who've had it lower their blood pressures. There's no studies. It's off labels. So why don't we give it a try? Why don't we try that and see what happens? That's another option. And then if it doesn't work, it could lead to some sort of surgery to alleviate those conditions. So in the medical model, it's drugs and surgery to alleviate conditions. And it's doing treatment to alleviate these conditions. So my question to you is, what is health in that scenario? What is health? Interesting, because my job as a maximized living provider is to show you how to maximize life the way that God intended you to. Do you think God said, hey, you know what? I'm going to design Americans to have high blood pressure, be overweight, have diabetes, be chronically depressed, have chronic arthritis pain, be ravenously obese? Or do you think there was a different approach to that? I think what is happening here is that the devil has gotten in here and allowed us to express these conditions. But God's body, you got to understand this, was designed perfectly to live 100, 110, 120 years of age without cancer, without heart disease, without diabetes, without depression, without fatigue, without aches and pains and being tired all the time, with all these weird symptomatologies. And so when I deal with patients, that's the hardest thing to get them to do, is to step outside the traditional model we've been taught by our parents or our friends or the television or drug ads or by different doctors. Our job as maximized living providers is to show you the path that God has lined out for you in your health and in your wellness. I can't tell you how many times I've had people that just say, man, I just woke up this morning and I was praying and praying and praying because I keep going to these doctors and I keep getting sicker and sicker and sicker. And then somebody shows them our office or they hear us on the radio. And that's why we get out there and spread this message of hope and healing, that there's a life and there's healing available. We have the technology to show people the way, but you can't do it inside the medical model. Not to say the medical model is bad. The medical model is amazing, especially at emergency crisis care. You get into a bad motor vehicle accident. You get into a bad trauma. You fall and break some bones and you compound fractures. They're going to rush you to the ER. They're going to do CAT scans and tests to make sure you're not bleeding internally, to save your life and mend you up and send you on your way. Clearly, that's the best part that medicine has to offer. I've been in third world countries and seen the emergency services there. Very scary. I'm so blessed to be here in this country, to be able to, if some sort of trauma happens, to step into that model and get help. I had a guy the other day came in, John, big guy. He came into my office. He's in his 60s. And I looked at him and I said, John, why are you wearing slippers? And he said, well, I just got out of the hospital. Oh my gosh, John, you've been a patient of mine for 2 years. You've been coming regularly. What's going on here? What happened? And he said, I went to my doctor and he told me that I had high cholesterol. So he put me on cholesterol lowering medications. That cholesterol lowering medication also lowered the function of my kidneys. His kidneys actually shut down due to a reaction from the medication. And so I was telling the nurse yesterday, she said, I told her about this story. She said, that's normally not the case. It's usually the liver with those cholesterol drugs that shut down. In this case, it was John's kidneys that shut down. And I asked him, I said, John, the problem isn't cholesterol. The problem is what else you're doing to your body. And are we keeping your nerve we're keeping your nerve system working, but there's something else going on to mess up your cholesterol. We got to find out what that is. And I told him, I said, cholesterol is for protection. Cholesterol is a hormone that protects your nerve system. And as you get older, it actually increases. And so a really good friend of mine got diagnosed with Lyme's disease. He went to a medical doctor and he said, oh my gosh, your cholesterol is through the roof. You need Lipitor so that you can lower these cholesterol lowering drugs. And Greg said, that doesn't make sense to me. So he goes to another doctor, flies out of the country, goes to a different doctor that specializes in Lyme's disease. And he says, that's the last thing you want to do in Lyme's disease is lower your cholesterol, because cholesterol is protecting your nerve system. Do you guys realize that 60 to 70% of your brain is made of cholesterol? So let's lower that. What are you actually going to do? You're actually going to cause more damage and more destruction to your nerve system. So I have a couple stories I want to share with you before we go to a break here. I had a patient who told me that she was going to be dead within 6 months by 2 different doctors. She had COPD, and she was emitting carbon dioxide into her lungs every time she breathed. She was gray, she was pale, wasn't alive. She's now alive and well, thanks to specific chiropractic care. I had a 1-year-old with chronic ear infections, breathing problems. He was facing surgery, tubes in his ears. He was on multiple medications since birth, now functioning perfectly. Some of you sitting here, you suffer from low energy, fatigue. You've had multiple symptoms, fibromyalgia. By the way, that's just a label. You've got these things that you've been labeled. You're tired, you're depressed, you're stiff, your energy's not right. You can't sleep well. Maybe it's numbness and tingling. You were in a recent car accident. You're the one that needs to call our office to schedule a time to come see us. Normally, when you come to our office, we evaluate you. We do a case history. We do a nerve system scan. We see where the pressure and stress is on your nerve system. God put you in control to run all your organs and tissues through the nerve system. So we do specific digital x-rays to see where the bones of your spine have shifted out of alignment that are choking off the nerves. We are the only doctors trained to look for this condition. Normally, it could cost you $200, $300, $400 for these services. But today, for the next 5 callers at 877-4-Dr. Troy, that's 877-4-Dr. Troy, or 360-260-6903, $25 for the examination, consultation, and the x-ray. So the next 5 callers, call our office right now. We have staff standing by. If you can't get through, please leave us a message. I promise we'll call you right back. We'll get you into the office as soon as possible. Our website, if you're interested in looking at it, is Zenaptic, chiropractic.com, Zenaptic, chiropractic.com. So the next 5 callers, 877-4-Dr. Troy. I'll be right back after the break. You're listening to me here, Dr. Troy, on Absolute Life Radio on KPDQ 93.9 FM. Hello, everybody. Welcome back. You're listening to Dr. Troy here on Absolute Life Radio on KPDQ 93.9 FM. I'm glad you're tuned in today. Before the break, we opened up the phone lines for the next 5 callers, 877-4-Dr. Troy. That's 877-4-Dr. Troy to get the computerized nerve scan, digital x-rays, and a consultation to see if we can help give your God-given power back on into your body. Earlier, we were talking about the maximized living model versus the medical model. And in the medical model, everywhere we look, our health is becoming worse and worse and worse and worse. I was asking a patient the other day, I said, where do doctors get their training from? Like, for example, at Oregon Health Science University. Where does funding come from? Who teaches? Many of these people who teach are typically taught by the institution continually over and over again. When I went to chiropractic school, we had teachers who never practiced, who were just teachers, and that, which is fine. But here's the thing. Where do they get their money from? Where do they get their information from? They get it from drug companies. They get it from companies that make devices or surgical implants or surgical devices. Their money comes from these companies that actually will fund their teaching so they can teach the doctors how to use their products. In Time magazine earlier this year, they did a front cover article that said what doctors hate most about hospitals. It was an insider review of what can go wrong and how you can improve your chance of getting the correct treatment. The question on the front page of the headline says, what scares doctors the most? Guess what scared them the most? It was being the patient. That's what scared doctors the most. I was looking at U.S. News and World Report, front cover. They had Bernadine Haley, who was the director of the Red Cross. She was a medical provider. She had an article titled Cancer and Me. She said she actually had a brain tumor. She said the cancer was insidious. It had grown to a near fatal state. And guess what? She had no idea. There was no symptomatology. You know, it's amazing when you look at that. We recently had our nanny, her father passed away, got diagnosed with lung cancer, had no idea, gets diagnosed with lung cancer, passes away within 1 week. And it's sad to see these things happen. But the more we look at this, the more we see and realize there's alternatives. There's an alternative to the way we approach treatment of sickness and disease. But here's the thing. We focus on, in the maximized living model, we want to focus on maximizing your health, restoring health, not necessarily to treat conditions or alleviate symptoms, but to teach a chiropractic way of life. An alternative to medicine would be nature or naturopathy. That's an alternative to medicine. Chiropractic is not an alternative. Chiropractic is a specific healthcare in and of itself. But nonetheless, in 1990, there were almost 5 million visits to alternative healthcare providers, chiropractors being the majority of them. And 7 years later, the number doubled. In 1997, out-of-pocket expenses for alternative providers was around $27 billion. That's how much people are spending outside of the medical model, out of their own pocket, to seek health and function. And that's one of the things we have to do with people, is make care affordable. That's one thing I'm so proud of our office and our office staff. We work it out with everybody who comes into the office. We make it affordable so they can get care that they need. When you look at these wellness-based chiropractors, what we can do and what we can offer with the rest of these alternative therapists, we are absolutely the most qualified profession to be leading the mass from the allopathical sickness to the holistic wellness care model. People are recognizing the value of wellness, taking care of their body, and they're willing to do that. They're willing to pay for it. Those of you who go, well, my insurance doesn't pay for it, you know, you're going to stay right in that model. I had a patient yesterday, they asked me, should I get insurance to cover this? I said, well, you're going to have to pay for your insurance, and then there's going to be some sort of restriction to how much money they're going to pay back to a doctor. And I said, you know, insurance is good for catastrophic things, but it's not good for health. See, and so you need to find a provider. That's what we do. We make it affordable so that we can get you out of the sickness care model, get you as healthy as we can. BJ Palmer said the medical men have always searched the world for remedies, desiring an antidote. Chiropractors find the cause in the ailing person. BJ also said this over 80 years ago. In the future of chiropractic, it will be valued for its preventative qualities. Did you hear that? For preventative qualities, as much as relieving and adjusting the cause of ailments. Bill Koch, he's a medical chiropractor back in the 50s. Only when the collective consciousness shifts can we expect to have a healthy population. That's why we get on the radio, to share the information. Because I'm encouraging you and your family and your loved ones and our town and our community is to shift their consciousness. People must change their current lifestyle in a favor of a chiropractic, maximized living, holistic lifestyle, not the medical model, which means waiting until you have sickness and disease to show up. The chiropractic lifestyle, listen to this, it includes improving your nutrition. It includes exercising. It includes keeping your nerve system free of interference. Check out this. This is from Dr. Chestnut. He's a medical scientist in British Columbia, Canada, and he says chiropractors do not treat disease. We provide care to human beings. The adjustment is intended to restore normal motion and alignment in the spine and spinal joints, whether or not there is a disease. As we understand as a profession that normal spinal motion is a prerequisite for normal brain and nerve system function. Did you hear that? Normal spinal motion is a prerequisite for healthy brain and nerve system function. Normal brain and nerve system function, that's going to keep you healthy as long as God intended you to be. we can feel comfortable and confident that normalizing spinal joint motion has a positive effect on the human being as a whole. It's possible through the function of the human being with or without drugs. Eating a good diet is ideal, whether you have cancer or not, right? Whether you have cancer or whether you don't have cancer or it's cured or not from eating a good diet, it's an illogical measure of the benefit of a good diet. We just know from deductive logic, in any case, is any chance at health is better with a balanced diet than without. The same thing can be true for a normal functioning spine and spinal joints and related tissues as it relates to the nerve pathways that are positively affected by the chiropractic adjustment. That's why people need to be under regular chiropractic care, whether they have symptoms or not, whether they have cancer or not, whether they have headaches or not, whether they've been in a recent car accident or not, because a healthy functioning nerve system is what runs and controls everything. I was reading about shareholders filing a class action lawsuit against Eli Lilly. These guys understood what was going on. You know, it's amazing when I look at this. We know that medicine is now one of the biggest killers in America. Eli Lilly's shareholders sued them because they claim the company falsely misled people concerning their blockbuster drug, Zyprexa. And they failed to show the link between Zyprexa and diabetes. And that's why they got sued. I would be scared about any chemical that you stick in your body because there are direct effects and there are direct effects. They're not just side effects. These are direct effects. You're hoping that Zyprexa would be an antidepressant, but it was causing diabetes. What else does Eli Lilly sell? Well, they sell insulin. Wow, check this out. Now you take Zyprexa, you become diabetic, so now they can sell you insulin. And they went on to say that they were engaging in illicit, off-label marketing programs, and the bottom line is they failed to inform the public. And that's the thing that scares me the most about a lot of this stuff. You know, it's a beautiful thing that we do. There is no direct effects. There's no side effects. There's only your body functioning at a higher level. I had a guy recently with hypertension last month came to see us. The Journal of Hypertension came out with a study comparing chiropractic to blood pressure drugs. And now listen, you got to understand, chiropractic is not a treatment to lower your blood pressure. But what they found was astonishing, that the people who are under regular chiropractic care, and they compared them to people on 2 medications, on average, they had a 14-point drop in their blood pressure. It's amazing to me that you can adjust the spine and have an effect on the internal regulating system, the internal organs. And this patient of mine's wife, she said, I would never go to a chiropractor. I don't have a bad back. See, a lot of people think that, but she said, I have high blood pressure. We told her, you have to come find out if chiropractic can help. She had a stressful job. And we told Dawn she needed to start exercising and improve her nutrition and getting adjusted. And these are things that are going to help the physiology work better. So it's amazing when you can start working with people and start helping them realize the benefits that God put the most amazing healing power in their body, and that we just need to check it. So if you're suffering headaches, back pain, neck pain, your arms are going numb, you're fatigued, you're tired, you have polymyalgia, you have neuropathy, fibromyalgia, you've been in a recent accident, please call our office and let's check you. I have one more thing I want to share. I just recently had an individual lady who, for the last 8 weeks, was not able to drive. Severe dizziness, low blood pressure. She went to the traditional medical route. They did all these tests on her, CAT scans, and thank God they found nothing wrong. She came into me, and we started working with her. We took some x-rays of her spine. We did an evaluation of her biomechanics, and sure enough, we found it was the first bone in her neck was out of alignment, putting pressure on the brainstem, on the nerve pathways that control the vestibular apparatus, the inner ear. And we started adjusting her. Within 2 weeks, she was able to drive again. Within 3 weeks, she was able to drive sitting on long trips for over 6 hours. So if you're suffering, give us a try. Call our office right now, 877 for Dr. Troy. I'm urging you, if you have kids, your family members, grandparents, loved one, spouse, friends, aunts, uncles that are suffering, and you know that they've just tried everything, I'm urging you to call our office, 877-4-Dr. Troy. We'll do a computerized nerve scan to see how their nerve system's functioning. We'll take specific digital spinal x-rays to see where the pressure and stress is on the nerve, if the body's breaking down, if the discs are degenerating. That way we best know how to help. For the next 5 callers, I'm urging you to call 877-4-Dr. Troy. That's 877-4-Dr. Troy. You'll get the examination, the consultation, necessary x-rays, all for $25. So just call us right now, 877-4-Dr. Troy. We have staff standing by. I'm looking forward to receiving your call, meeting you in the office, and helping you achieve your healthcare goals. Our website again is Zen, Z-E-N-A-P-T-I-C. It's Zenapticchiropractic.com. Thanks again for tuning in today. My time is up here. I had a great show with you today. I'll look forward to hearing you and seeing you in the office. And we'll be back on this radio station, 93.9 KPDQ FM.